Hey y'all, it's me, Dr. Smina Rahman, Gyno Girl. Welcome back to another episode of Gyno Girl Presents Sex, Drugs, and Hormones. I'm Dr. Smina Rahman, board certified gynecologist, sex med gynecologist, and menopause expert in downtown Chicago. Um, on my podcast, we move sexual health out of shame, fear, and misinformation and back into evidence, embodiment, and agency. Today's conversation is one I think many clinicians and patients are likely craving. I'm joined by the amazing Dr. Shannon Chavez, a licensed psychologist, certified sex therapist, and the founder of Shape Psychology. Dr. Chavez specializes in integrative sexual health, intimacy, and relationship wellness. Her work helps individuals and couples reconnect with desire, deepen emotional intimacy, and develop a more mindful relationship with pleasure, one that moves beyond performance and metrics and pathology. Importantly, she also works with individuals and couples navigating compulsive sexual disorders and behaviors, including concerns around porn use, through a non shaming, trauma informed, and clinically grounded framework. And so, hopefully, we're going to talk about that. She's been featured in Oprah Daily, Vogue, GQ, Women's Health, and Huffington Post. And today, we're going to talk about pleasure literacy, sexual shame, compulsive disorders, or behaviors, and how clinicians can do better when patients bring these concerns to the exam room. Welcome, Dr. Chavez.
Thank you for having me. I'm happy to be here.
So exciting. I met her just like a month or two ago. I think we were doing a Perry Live, or was it a Perry Live? It was
Yes.
for the Perry community, and
Okay.
you and I and Garbage Mom, Beth,
I love
just
Beth. That was so much fun. We had such a great time.
we had a great time. And I was like, wait, how do I not know you? So I was like, I thought I knew everyone in the sex med space, but I was so happy to learn about you because some of the
Same.
things you said just really struck a chord in terms of like, when we were talking about sexual shame and communities of shame, which brings me to like, my uh, Instagram handle is Gyno Girl. So that means that I love comics and I love a good backstory. So I want to hear what your backstory is, like how you came to become a sex therapist and, what brought you into talking about this out in the open into the world.
I love it. I was just telling this backstory. Actually, I was talking to my mom about it because it starts with a book that was on her book in her nightstand. So
Really?
I would say as a kid, I was always curious. And I grew up in the 80s and sex
Yeah.
was not talked about. I mean, my
Yeah.
parents we grew up, we're Latinos, so we grew up in a conservative culture, but my parents were
Yes.
young. I mean, my mom and
Yeah.
I are about 20 years apart. So they were
That's,
young and trying to do things different. And they had the
yeah.
joy of sex in their nightstand. And I remember
Oh,
being 5
really?
years old, peeking around mom's room, and I
Yeah.
found the book. And I remember being like, the joy of sex. And I would sneak it and read it. And I was just so fascinated by the idea of sex. And as a curious kid, of course, what do? You ask your parents, like, what's this? And I just
Yeah.
remember my mom being mortified. Like, what do I tell a 5-year-old? What do I tell a 6-year-old about sex? I'm always curious and comfortable, and it was a fascinating thing. And for me, it seems like a natural part of our life. So, the older I got, the more interested I got into it, but I saw how uncomfortable it made people feel.
Yeah.
And I didn't know a sex therapist existed. And I remember watching Dr. Ruth on TV, this
I
cute,
know.
tiny lady, and going, wait, I want to do what she's doing. She was so
Right.
approachable and sweet. And I'm like, she gets to talk about sex and help people and educate. And to me, it was a natural calling. And it's kind of interesting because when I was in high school, my sex ed teacher, because we always talk about lack of sex ed in
Yeah.
education, she was a health teacher like many high schools, and
Yeah.
she was actually the one to start the abstinence only program, across the nation. So I always say I would love to
Um,
interact with her again and be like, "What?" Like, now I'm educating people and the stereotype.
I know. It's so funny. Oh my god, that's so interesting. I mean, it's true about Dr. Ruth too. When I was in college, I remember people would joke like, because I also grew up in the '80s, but people would joke and because she was kind of big back then, and then she continued to be big, and it's oh yeah, you're gonna be like the Muslim Dr. Ruth one.
Yes.
My friend, she reached out to me recently. This old friend, she's like, I can't believe you're doing what you said you want. I mean, I didn't say I want, but they knew I liked women's health, and I was like trying to break down taboos and whatever. But That's so
That's
funny.
how I feel too, because I remember being a kid like, "I wanna be a sex therapist," and in my culture, like, therapy's kinda taboo anyways, and then on
Totally,
top of that,
mental health
sex
in
is
general, right? Like, it's not a real thing. Yeah.
exactly, and then you tack on sex along with that, and people are like, "A sex therapist?" Like, my mom just doesn't wanna say it. She's like, "Shannon works with intimacy," and I'm like, "Mom, you can say sex," and now my mom's so open, her and I chat about everything. In fact, I'm mailing her a little care package this week, so she's like, "Send some lube, are there any new products I need?" So I love
Oh,
that
that's
we have that
that's
relationship.
that's so funny because I mean, to this day, I like I would just tell my parents and my mom passed away last year, but my dad now I'm just like, "Oh, I just talked about menopause." And they're like, "Oh, okay." I still can't say that like I'm a sex mentor for this one.
Isn't
It's
that amazing? I mean, as we talk about
um,
shame, even the more you talk about it, I still feel that at times too.
yeah.
Yeah, something will kind of, hit a note, and you're feeling like, oh, there's still that old feeling in
I
there.
know.
Like, all we get.
It's like, a few months ago when I had my book cover I had my book isn't out yet, obviously, it's gonna come out next year, but I had the book cover, so I posted it on social media, like, a few months ago. I'm like, "This is my cover, this is the book coming out." And so then my dad's like, "Oh, I heard you wrote a book because your uncle follows you on social media. What's that about?" And I was like, "Um, women's health stuff how I."
Yes, yes.
"Oh, that's so amazing."
Love that.
Anyway, it's so crazy.
I can't wait to
Mm,
read your book. I love that that's sort of a
listen.
niche and area you're speaking about too. I'm just so happy we connected. There's so much crossover.
No. Oh, I'm so excited. Um, well, let's talk about sort of, the idea of shame and how you approach it in your practice, right? Because first of all, you said you grew up Catholic and it's sort of probably like sex shaming. I would say like after the number of Muslim patients I see, I think the second biggest is the Catholic population, because of the same similar, underlying tenets, right? So tell us how you approach that in therapy.
Well, first I normalize shame because I
Right.
tell people we're not born feeling shame. It's a
Yeah.
learned behavior. We learn to feel certain ways about sex
Yeah.
or sexuality or our bodies or our gender or our roles. And
Yeah.
so normalizing it and creating a safe space. I think people think of shame as something's wrong with me. And
Mm,
that's probably the second question I get, is this normal? Is
right.
something wrong with me? These
Yeah.
questions where
And
people just
yeah.
feel so broken. And shame is something that we'll all experience, but I normalized it. I give people a space to talk about it. And then overcoming shame is more of an empowering lens that I use. It's not about fixing something or changing the way you think. It's basically evolving and learning more. So I really create, a collaborative approach for people to get good information,
Yeah.
ask questions. I always say, no
Yeah.
question, dumb question. Because I see
Yeah.
people come in like, oh, I
Yeah.
don't know.
Mm.
Can you say these words? And so
Right.
I'll use language and kind of match the language that a client's using, or if they're using kind of slang terms, I'll use those as well, just to create kind of a safety around, talking about sex and learning about it. And I always say we're learning about sex our entire lives. So
Yeah.
even if we're shame or we're embarrassed or we feel like we don't know enough, I just create space for that and a little bit of humor because
Yeah.
the opposite of shame is acceptance, and the more we can accept that, sexuality is kind of this vast and bizarre and sometimes weird thing that we all go through,
Yeah.
it makes it so much easier and so much more approachable.
Absolutely. I think you're totally right. And I think that's so much of what when the patients come to the office and they can't even it's interesting because sometimes they don't even have words to describe their pain sometimes, right? Because it's all down there. Or, like these euphemisms that we use for women's anatomy, even, right? Like I have a whole chapter on my book about it, but like it's just like if we can't even say the word, how can we diagnose anything? And so that's why it's so important to teach early on that, like, my 6-year-old knows vagina versus vulva, like, it's just, the reality is that's not what we were taught. And that's not, I mean, we're even censored on social media still, right? We can't even say these words on social.
Oh, yes, that's a whole nother soapbox. But the fact that we're out here trying to educate, and I remember I was talking about endometriosis, which is something that I have experienced throughout my life, and I got censored for that. So I just the
Oh,
social media and how they you can't say these certain words, and then it just that kind of reinforces shame because if you don't have a space, if you can't talk about it in a social platform, where are you going to ask the questions? How are you going to have the language or the skills to feel comfortable, advocating for yourself. So,
and so we were talking offline that both of us treat a lot of sort of pelvic floor dysfunction, vaginismus in these
yes.
populations that can grow out of sexual shame. And so whenever I say to like tell my patients it's biopsychosocial, like I'll handle the bio part with the pelvic floor with my therapist, and but you need to see a sex therapist too. I tell them that, and so they always like get into a little bit in their head about it, like what will they do? Like what is sex therapy? Like then they start thinking masters and jobs
Right.
for the
Are we
people.
going to make you watch porn? I know. I get so many misconceptions about what the work is and what it
Yeah.
isn't.
So, walk us through, like, a patient with, say, vaginismus, right? They come to see you, or which is, a severe form of involuntary pelvic floor contractions, a form of pelvic floor dysfunction that leads to either unconsummated marriages or, sexual pain. So, tell us about how you kind of approach that, like a patient that comes in. So, say I refer you to someone, how would you start that interaction?
Yes, I create a safe space. I always like to meet the person before the problem because every person's different, even
Yeah,
vaginismus, our
yeah,
background, our culture, what we've learned, what we've tried, our
yeah,
relationships. So it's such an intimate relationship in therapy. It's
yeah,
very intersubjective. So getting to know you, understanding your lifestyle, your background, that's where I kind of get a sense of your language and how you communicate and what you know about your body. There's a lot of education as well. So I'll do a very thorough sex history, and even if you don't have sexual experience, I want people to know sex history is many things. It's what have you been exposed to? What are the
yeah,
messages that you've received? If you had any education, what was it like? Was it shaming? Was it negative? Did it scare you?
mhm,
Some of the ways that we can kind of normalize, the gaps that are in a person's sex history. And then we, very collaborative. We develop goals together. I always tell
yeah,
people therapy has a beginning and a middle and an end. So it's about progressing through at your pace and what do you want to learn? And I'll say,
mhm,
in an ideal space, what would be everything you would want to know to make you feel confident about your sexuality? And it can be, the basics, understanding the mechanics of sex, but also a lot of people will say, I want to feel confident. I want sex. I want to feel, I want to get over these mental
yeah,
boulders and blocks that make me feel that I'm not good enough. So
yeah,
next thing is, it's like traditional psychotherapy. It is talk based, but I do a lot of behavior modification, very body based, very mind body based, because our
mhm,
body stores so much. I mean, that's where our emotions live. So helping
mhm,
people connect with, what's going on in my mind and how it affects the body. And then slowly introducing things that can help sexual wellness. So that might be things like products and devices or ways to kind of get in touch with your body, learning things like genital massage. And so, someone with pain, I right away think helping you feel comfortable in your body and not feeling that expectation around having sex, but to learn about your nervous system and learn to connect with what your own sensations are and what feels good for you.
yeah. No, that's great. I think that's one of the things is also is, someone that's lived in pain for so long, even when I feel like the biology of it is fine, right? Like their pelvic floor is perfect. Like they're now, they've had all the treatments, they've had the vestibulectomy if they need it, whatever it is. But if you're someone that lives with it, what is it? The body keeps score, right? It's a book that's about.
Exactly.
And so I
Exactly.
that's why I think it's so imperative what what's done in the mental health space on this.
Yes.
Um, and so how do you help them kind of someone like that, like where they've lived in it, but like now they can put in dilators, they could technically should be able to have sex, right? Like there's not this automatic contraction, their pelvic floor is not, hypertonic, but they still can't mentally get past it.
Exactly. It really is a mental rehearsal. Sometimes we'll do a lot of visualization and
Yeah.
imagining what that looks like. Because when
Mhm.
you've lived with pain, and I have as well with endo, you're used
Yeah.
to just feeling not so great in your body. And then that
Yeah.
affects how you feel your self-esteem. And not wanting, even your nervous system is overactivated. So a mental rehearsal or a visualization may be, what would that look like? How would your body move if you were feeling desire? Or when you imagine having sex that doesn't hurt, what do you imagine that looking like? It can feel a little vulnerable, but then people think, well, I actually have to picture that. If I can't picture that, then it's going to be really hard for me to actually go out and have that happen. So we do a lot of work like that. I also do things like hypnosis or really working on deeper subconscious beliefs that affect our core beliefs about ourselves. So I find that a lot of that can help, just giving people permission to feel sexual, even if, to your point, pain can be resolved, but we don't always say, it's okay for me to feel desire, or it's okay for me to get horny and feel excited about sex, especially women. We feel we kind of need that permission, and especially coming in a safe space and therapy, it's important. Like, yeah, it's okay for me to want sex. It's okay for
Yeah.
me to enjoy it, and not identifying with the pain is also really important. I always
Mhm.
say you're a person experiencing pain, but vaginismus is not your identity, or endo is not your identity. It's just something we go through, and we go through a lot of things through our lifespan that affect sex. So it's important, with the mental health piece, that you don't identify and feel like these are, these stigmatizing diagnoses that just carry around with you and affect how you feel about your sexual self.
That's so true, actually. Yeah, because I think that's what people just automatically and some clinicians do that too. Oh, that's my vaginismus patient. No, that's your patient with, right? Because that's how you start to, and that's our own implicit bias. And sometimes
Yes.
you can't see the forest from the trees to help them in that respect.
I even see that, when my clients are dealing with, depression and anxiety, when they start to alleviate some of those symptoms, and they're like, wait, I'm not a depressed person anymore. I actually feel joy, and I'm,
Yeah.
taking control, and letting go of the identity that you've carried around for so long. And there is sort of a grieving process, even though you're feeling,
Interesting.
better and you're feeling
Yeah.
stronger. So
Mhm.
it's just interesting how we internalize what we're going through, and then it affects our mindset. So we've got to do a little shifting and working through
Yeah.
that in
Yeah.
therapy.
It is work, though. I think that's one something that people have to realize is that you have to put in the work, or it's not going to just usually happen on its own.
Exactly. We wish it could be a quick switch, but
Mhm.
it's again, permission, really giving yourself that path to move forward.
Mm. Yeah, that's great. I want to talk about something that's, comes up a lot clinically, but also culturally, and that's when patients, it's often referred to as porn addiction, but we know it's
Yeah.
compulsive behaviors. Um, and it ties into shame a lot, right? Because when we were talking about growing up in the 80s, like porn was not as accessible back in the day. You had to wait for the HBO, like,
Never
crazy.
more. Yes.
Maybe or you'd see something, scandalous. I don't know. But it's not like it was like so accessible back in the day in terms of that. And now you can just pick up your phone and literally like look at it. And so obviously there's like, you know, phone addiction in general. Like I feel like people are just compulsive about and I myself am not the best at it either, but you get a little bit attached to this thing. But I feel like the compulsive behaviors plus the shame that we already have around, what is moral and unmoral behavior when it comes to sex and porn. How do you distinguish this you know, compulsive behavior versus like a healthier desire? And how do you kind of treat these patients?
Yes. Well, I always tell people anything can claim our consciousness, to your point. So it's not just porn that's an issue, but it's how we're using it. So for a person that might be more compulsive in use, they are developing a sense of dependency. So it's not just about, I'm feeling, desire, or I want to masturbate and I'm using porn. It becomes a coping mechanism, and they need that coping mechanism in order to regulate. And some of the things that they're regulating are stress, anxiety, depression, and boredom. Those are probably the four main areas that I see. And it creates escaping, escaping behavior. It's isolating. So oftentimes there's a cycle. So it may be I'm getting that alleviation, or I'm engaging in the porn, but then afterwards there's a lot of shame, there's a lot of guilt. Then they're coping again with those uncomfortable drivers. So it's this cycle that keeps repeating itself, and it becomes something that's out of control. So they may want to try to stop or cut back. They also can develop kind of a tolerance, and even more of a seeking out of the behavior. So it kind of, tolerance and withdrawal that makes them engage in it even more. And it's not something that feels good. So most people will have a level of distress. So that's how I sort of distinguish compulsive use and, maybe healthy engagement in using porn. It's the distress that comes along with it. So I feel feeling more depressed, or I'm isolating more. It's affecting my day-to-day functioning. I'm not able to have healthy, intimate relationships. Sometimes performance issues. They're not physiological issues that come up. And so it starts to create a lot of kind of whole body issues that come across, and it creates a lot of distress, a lot of self-esteem issues, not feeling good about self. And I see it a lot in relationships. I would say most of my cases now are couples coming in where one partner is having issues with porn, and it's affecting every aspect of their intimacy, physical, emotional, communication.
Oh, it's interesting that you're saying that. So you do with a lot of the couples that come in, and the person that's being affected, and the person that's actually doing it. How, I mean, obviously, it's you have to deal with a lot of their issues and anger issues that come up. How do you kind of help them navigate this? Um,
A lot of education, because I think at times it becomes, for the partner who's not the one that's using porn compulsively, it's, why can't you stop? Or, there's a lot of betrayal. There's
yeah.
maybe things the partner who's using has said that have affected how they feel about their body.
Hmm.
It's come into the bedroom in terms of how they're having sex. So I create a
Hmm.
lot of education and a lot of communication, because oftentimes there's a lot of defensiveness or avoidance, and there's
No one,
complications
right?
they wanna talk about, or they don't know and they get defensive, and then there's more hurt feelings. So creating good communication and understanding around what it is, and then helping behavior modification, replacement behavior. If you're using porn to cope with stress, let's come up with other, safer, more effective ways for you to deal with what it is, and seeing it not as sexuality. I mean, what's complicated about porn addiction or sex addiction or any of these so-called process addictions is, we don't want a complete abstinence. Sexuality is a really healthy part of our life, but a lot of that education requires kind of helping people to reset good coping mechanisms so they're not using porn as that outlet, and then learning how to have sex in a healthy way. Especially a lot of young men that have had more compulsive porn use. They've had no education. Porn is all they've known, and so they've learned about sex and intimacy through porn. And as we know, porn is sensationalized and entertainment, and it's not giving you, anything about intimacy or communication. So I'll, create a lot of, resources so that they understand, what it is and what it isn't. And, it's entertainment. I also teach them it's not designed to, it's designed to overconsume. Porn is
Yeah.
not designed to just be like, oh, let me like watch a quick film and enjoy it. It's meant to really keep you engaged and keep you coming back to it, just like scrolling. Doom scrolling was invented
Well,
11 years ago, and now, it's all of these platforms are not meant to just be, kind of looking at here and there. They're kind of meant
yeah.
to keep
No, you
you out
wind up.
there and consuming
Yeah.
good stuff.
I need to figure out how to stop myself sometimes.
I do too.
Because
I'm like, phone out of the
yeah.
all of us. It's just sort of technology, as you said. It's designed now to be accessible and always available. So yeah, you're feeling sad. Here's porn. You're bored. Here's porn. So it's everywhere. So it's really important to kind of notice how it can capture people's consciousness quickly.
Totally. What do you think? Like, obviously, this is an area you treat. And we see patients in the office that might have premature ejaculation. I mean, I'm not a urologist, but I'm thinking of my patients'
Mhm.
spouses who took because I always ask about the significant others. And so, you have these people that might have this sort of issue around their sexual health causing a problem for the sexual couple. Um, but what do you think clinicians kind of get wrong? Because we all have implicit bias. So then your mind always goes toward one direction, like when you think of some of these things. And so, what do you think clinicians get wrong when we think about this as an addiction or that kind of thing?
I think even just the word addiction, it sort of
Right.
implies that it's, very similar to kind of, chemical substance, and that if you just sort of remove the thing that's causing the addiction, then that'll solve the problem. And that's really what the
Yeah.
sex addiction model started in. It was just basically, let's take substance addiction and apply it to sex. And so it was very negative, very abstinence only. And I was actually in that world. I did a postdoc in that world, and I
You
saw,
did? Okay.
going through, continually relapsing back into old behaviors. So I think for clinicians to know that a lot of it's based on early trauma, early attachment wounds. It's not
Mhm.
just about, an addiction that got out of control. A lot of it is, kind of diving deeper into a person's early life and their
Mm.
early behaviors. I think at the core of most of these compulsive behaviors are intimacy disorders. And the more you heal and create, healing around intimacy and education around intimacy, the more people are able to overcome these concerns. So I think the sex negative sex addiction model has actually done a lot of damage. It's created more stigma and more pathologizing.
Sure.
And uh, it hasn't had a great success rate. So I think that was the big piece that was missing when I was in that field was we have to create some way for people to get healthy sexuality and not sort of demonize sex or porn or masturbation as these things that we can't control, but give them some resources and ways to understand what their behavior is telling them or what is their behavior stemming from.
Sure, yeah. I mean, I guess do you treat a lot of people that have the compulsive behaviors around sex on top of just porn use?
Actually, I sort of say sex addiction falls into three categories. It's either love romance or sex, which can be masturbation, porn. And I actually did most of my doctoral research on love addiction because
Okay.
I was so fascinated by it. And
Mm.
can we be addicted to love? And then they were saying at the time, men are sex addicts, women are love addicts. I'm like, what is this all
Oh, it's
about?
so fascinating, yeah.
I actually kind of wrote a manual, an attachment based theory and on how to work with it. Attachment therapy is incredibly helpful for early trauma and intimacy issues. So I think it's just so much more than what the addiction model shows.
You think so you're saying it kinda starts from maybe a lack of appropriate or maybe a longing for love early on that didn't sort of translate, and then
Yeah, dysregulated nervous system, not knowing how to get your needs met, and then
yeah.
internalizing that, like learning to escape or being, finding ways or behaviors. Because if you really go into someone's history who might have compulsive porn use, sometimes I'll see very similar themes. There might be childhood neglect, or they witnessed a lot of abuse in the family, or they sort of had this, unsafe, dysregulated household. So they didn't really learn how to take care of their emotions. So they learned to find external sources for that. I kind of, porn and masturbation as process addictions, the same as people might overeat or,
Sure.
work or
Reward
things that
casting. Mhm.
exactly. So if you look at someone's childhood behaviors who might, have more compulsive masturbation in their adulthood, you might see some of those same things. Some things that look like we would put under the category of more obsessive compulsive behavior.
Yeah, and I think when we talk about some of these things, even this sort of like, this compulsive behaviors, I don't think we do a good enough job either clinically or whatever in looking at sort of adverse childhood experiences, right? There's so much more data coming out about ACEs and how it's
Mhm.
impacting patients across the board, not only in their like, sexual health, obviously, but so many other arenas, right?
Yes, exactly. I'm happy that research is coming out because it helps people kind of put all the pieces together. Because back to shame, right? You can come in and say, I'm, having out of control behavior around masturbation, or I'm using too much porn, and there's so much shame around it, and you feel like something's wrong with you. But when you kind of make those early connections, you're able to, find out so much information about, what their nervous system was going through in those early experiences, and just even I always say, even most mothers go through postpartum, and postpartum is incredibly it's incredibly intense experience for any mother, and a lot of mothers don't have support around that, and they're raising young kids, and then the kids are developing these sort of senses of, uh, you know, uh, anxiety and early dysregulation around their nervous system, and how that can lead to a lot of these behaviors.
Absolutely. I I did a Substack because I don't know if you watch Stranger Things, but I was,
I just finished the finale.
you did? Because I had been doing some research on ACEs, and all I could think about was like, "My god, what are these people gonna experience later in life?" So I
So
kinda
true, right?
I'm like, "Oh my gosh, just imagine." Anyway, but I think we don't bring that into account enough, so I'm glad people are doing it now. Talking about, um compulsions. And when people say that, maybe come over it and they say maybe they don't feel like they trust themselves anymore, um, versus what when you're talking about trying to normalize like a healthy sexual experience for these patients, um, how do you help them to make that distinguish that like this desire is normal, but trying to like break from that compulsion where they might not feel like they trust themselves anymore? Does that make sense?
It does. I think your point is good, right? What's normal desire? Because people will ask that. Do I just have a high libido, or is this a problem? And that's what
Right.
we want to sort of distinguish. And I think even understanding desire, when there's urges, arousal is sort of this complicated thing because people look at arousal as just sexual. If I feel
Mhm.
something, it's
Yeah.
sexual, and then that's an urge, and then I have to go take care of myself. But I
Yes.
think that you do a lot of education around, arousal. There's a lot of ways we're aroused. We have
Right.
emotional arousal, physical arousal, and
Right.
so helping people understand. And I think also creating a lot of space and technique around self-soothing. I find that most of my clients that are going through any compulsivity have no skills around self-soothing. When they're feeling overwhelmed, they don't know how to self-soothe. So we do simple things, learning breath techniques, checking in with the body, even self-sensate focus. Sensate focus is a very popular exercise in sex therapy, but be even learning soothing touch. Because if we think back again to infancy and childhood, self-soothing is our most natural way we learn to connect with our bodies, even before we have all this intellect and language. And it can be simple things, learning to tolerate touch. And I'll find that a lot of my clients with compulsivity have a lot of neglect around touch growing up. They didn't have a lot of healthy affection. They didn't really learn when they were crying or overwhelmed, how to, normalize and take care of themselves. They were told to, avoid it or cut it off or not talk about it. So they, hold that in their bodies. So I really give them simple tools on how to self-soothe, and not just learning primal, what I call primal intimacy. Sex is not just all about intensity. It's also about, slowness and sensuality and connection. And so they look at sex as less of this mechanical thing that we do and that it's all about the physical body or the genitals and more about, the connection. It's a social connection. It's just one of the ways we socially connect out of all of the ways that we do as humans. And those are our drivers. I always tell people we can live without sex, but we can't live without love and connection. That's really our, you know, b- all of the studies that we've seen, love can affect your physical health, lack of love or neglect. So I help people see that sex is not just this thing we need to either do more of or do less of. And it's, quantifying it, but learning how to have quality, intimate experiences. And a lot of that starts in therapy. I'll model that good eye contact, reflective listening, giving them the sort of a pace where they can, feel things and kind of sit with their uncomfortable emotions without having to intellectualize them. So
Yeah.
it's a lot of skill building. I think that's the most important part of overcoming.
That's so yeah, because I think that's stuff we just don't learn, like, especially if you if you were raised by, like, a boomer, you're not learning any of that. So
Exactly. I think we all can agree on that one for sure.
well, I mean, especially because you and I are both well, I'm not sure if your parents immigrated or your grandparents did, but, I think when you're a product of immigrants too, like, most of them are just in survival mode coming into a new like, I feel like my parents, when they came here, really were trying to figure out the best way to make a quality life for themselves and establish themselves here, and that trauma in and itself is so huge, right? It's just like a huge change and a huge like loss of your former land. And I just think about some of those things sometimes. Like I said, my mom passed last year. I just think so much about her and how she left, everything behind to come to here to make a life for us, really, really, like,
Yes,
and
and that's a good point, that intergenerational trauma and things that are sort of normalized, and even, those generations wouldn't identify that. We're just now starting to make trauma more of a topic that people are really understanding. And I always tell people we're kind of born into trauma. Trauma is a big part of our life. Birth
yeah.
is traumatic.
Right, that's traumatic. Exactly.
We go
That's
through. I mean, we're just in survival mode constantly in our lives. So that's why connection is so important. That's why intimacy is so important. Whether it's community or romantic intimacy, it's just it's part of human nature. We need that. We need to be in community. And that's why I see with these compulsive issues or other issues, a lot of it is isolation. So many people are isolated, and all this technology is creating even more
Yeah.
isolation. And that's just amplifying all these issues and sort of creating even more generations where this trauma is sort of unresolved. So
Well, I
it's
mean, that's what I think what the Surgeon General a few years said that loneliness was a pandemic. It's like
yes,
it's a or epidemic, sorry. But it
for
feels that
sure.
way, you know?
Yes. It really is. And then now we have AI and people having AI companions. I mean, it's a whole area that I think all of
Uh-huh.
us in this field are going to be doing a lot of work around to figure out how to help people. Uh,
Actually, I don't know if you're coming to Ishwish this year, but we have I'm the scientific chair for the International Study for the Study of Women's Sexual Health. We're doing a whole symposium on AI technology and how, some of these things are I don't
yes,
know.
I will be there. I can't wait to hear it because I want to know too. I want to learn as well. I know AI is going to be a part of our lives, whether we want to or not, and it's going to affect sexual wellness, whether we want to
Yes.
or not. I was just speaking with a client the other day. Now there's a whole AI around, writing your own erotica, and so the whole AI and erotic world are starting to, collide. And so, yeah, we're gonna have to be talking about the ethics and the consent and, all the boundaries that, or boundarylessness of some of these,
AI for their own therapy. I have, like, patients who tell me, like, "Well, I just asked ChatGPT blah, 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 and all of a sudden, like, he reassures me, and he does this, and he does that." I'm just like, "Okay, but,"
oh, I'll get that too. "Oh, I asked ChatGPT agreed with what you told me." I'm like, "Well, I'm glad that ChatGPT
Glad Chat
me and not against me here."
Right, at least for now.
At least for now, right?
Well, until, we my husband always jokes, "Well, I feel like my future self is gonna come back and warn me about what's gonna" like, he's a sci-fi kinda guy.
It's a
Anyway,
wild world. I mean, we're gonna see a lot that I mean, it's going to affect our work definitely. So I
I
think
mean, did you see I think I saw in the news recently that, like, some woman married her ChatGPT or AI person in somewhere in Asia, I can't remember.
oh, the statistics are wild. I was at a conference recently, and I think there was something like wasn't 50%, 30 some percent of people in surveying said that they would prefer an AI companion over a human. So it's a thing, and it's
Um,
because again, you're getting your needs met and building intimacy in a way that's safer. I mean, there's certain things we can kind of take from it. What does that provide that they're not getting in the real life? But you also want to be able to intimacy is also about vulnerability, being
yeah,
able to deal with letdown and not
yeah,
everything has to go perfect. And
yeah,
sometimes boundaries. And that's what
yeah.
I get concerned about as a
You don't want
clinician.
someone always say, like, "Great idea," and, "This is perfect," like how
Right. Or I'll do anything you can sexually. That's what I'm
yeah,
concerned about AI companions around sex is that it's sort of like a porn, same issue with porn. It's sensationalized
mhm,
performance based, and it's not going to teach the skills of one on one partnered intimacy, which is just a whole different experience. It's not it's not quantifiable. It's about creating an
mm,
experience that's mutually enjoyable. So
right,
yes,
right.
there's some big concerns there.
Oh my god, you're so right. You also talk a lot about pleasure literacy, like, as foundational for so many, relationships and your sexual health. Um, how do you think that really works to prevent some of the stress that we're talking about? Obviously, I think because most of us lack a lot of this most we no one grew up with any of this literacy, I guess that's why.
Exactly, or even thinking about pleasure in terms of sex. I think people think of sex as this, this thing we do, penis and vagina or genital focus. And I try to bring in just the idea of, we've been pleasure seekers since birth. Pleasure is a way that we experience life. It's so many, it's not just sex, but, understanding that it's different for everyone. That's usually the first step. My I always remember this case that came in, a client that said, I want to have great sex. And I was hoping you could tell me exactly what that was. And it'll always stick out to me because I remember telling her, my definition and your definition and this person's definition are all different. My goal is to help you figure out what that is. So with pleasure literacy, it's really helping people figure that out. What's pleasure mean to you? How do you seek pleasure? What does pleasure look like in your life, even outside of sex? And when I start, especially when people have more shame getting into what they do in their life. I'll put sex to the side for a moment and be like, "What are you passionate about? Tell me about your hobbies. What do you do? What makes you
Yeah.
happy?" And they light up. I see the libido, like, "Yes, I do this and I have this hobby." I'm like, "Great." I mean, that's the energy we want to bring into sex and pleasure. And so it's kind of creating that connection that, sex is just part of that. How do you then passion in a place where you can feel good? And maybe you have to involve your genitals. Maybe
Yeah.
it's about, other forms of sensuality. And a big
Right.
part of it is creativity and play. I think that's such a big part of our human nature. I mean, we've been doing it since we were kids. And as adults, I
Yeah.
think that's our biggest crisis is that we don't play enough. We're not, in our creativity. Everything
Mm,
is,
sure.
what do we do? And we don't have enough time. And, just the adult mindset
Go,
of
go, go. Yeah.
and over responsibility, and then sex gets tagged onto that as well. It's just another thing we have to do or figure out or, the responsibility,
Another
and so
to-do list. I
I try to kind of rewire that a bit and recondition that, like, let's make that about play and fun. I mean, if you were thinking
Mhm.
about having, play, what would that look like? And creating a sex life that you want rather than, it, having to fit into a certain number of times a week or, I have to, boost my libido or all these things we hear in the articles we read and the books. So I just want to give people more permission to really design their sex life and think of pleasure as something that we can always access, even with low libido. It's
Sure.
something that we can always access. It's just about
Right.
kind of opening that up rather than feeling like we're waiting for like a pill to work or a switch to go on or,
Yeah.
my desire falls out of the sky and I finally feel different. I want
Yeah.
to empower people to take control
To
of
take
that
that.
and not
Yeah.
feel like there's a magic solution that's going to fix everything.
Right. No, it's so true because I mean, even when sometimes we talk about just what brings someone happiness, and some people can't even define it. I was asking a patient one day, I'm like, "What brings you joy? Like, what is it that you're looking for?" And they're just like, it's like they haven't even thought about it, or when is the
Okay.
last time you felt some pleasure or happiness about something? And sometimes they can't,
Exactly.
and I don't know if it's
Exactly.
retributive. Obviously, there's so many factors, given where our state of the world and all the things happening around us all the time. But I think also just, nobody thinks about what pleasure means to them, right?
Exactly. Exactly. And it feels overwhelming. I always say, pleasure is all connected to our senses. So sometimes we'll talk about, just what's your sensory experience like, and it could be simple things. Sometimes, especially with women, I'll get into grooming routines. Like, do you like putting lotion on? What smells do you like? Do you like to light a candle? Do you like to put music on and move your body? Sometimes it's simple things that you do when no one's looking that bring you joy. And you don't really register that, but it's sort of that
Yeah,
freedom to sort of be embodied and in a sensual space. And we all are sensual, whether we're registering it or not. So I try to, that's sort of the primal intimacy I try to get people to connect back with.
yeah,
Sex is really simple, intimacy and pleasure is simple. And it's not meant to be. I mean, humans intellectualize it to the point where we don't wanna have it. We overthink it to the point where it feels overwhelming. So I try to,
yeah,
reset that and so people can see it as, the simple things. It could be flirting, it could be brushing by your partner, it could be, putting lotion on and feeling just good in your body. It could be
yeah,
moving and walking in a new way.
yeah.
There's so many ways that you can reconnect with that. So it's gonna be different for everyone. There's no manual that you're coming into
I
sex
mean,
there. You must do all these things to be
right,
sexually empowered.
right.
I mean, that's what
Just
I
trying to
love
figure
about
out exactly. Well, that's
everyone's joy.
great. I love that you're doing that, and I love, everything that you're doing in this space, actually. It's really amazing. Um, my husband jokes that my listeners are like, vagilantes.
Yeah, I love that.
But, so I have this thing I do at the end of our, podcast, Vigilante Verdict. Like, what's your hot take that you want the listeners to either remember or to think about more, do more of?
I wanna say just take charge of your sexuality.
Yeah,
Every day is a different day, and it's different every day. As a woman in perimenopause right now, I can tell you it is different every single day.
every
So
single
and you're not broken, that's most important too. We all 100% of us, myself included, we all go through sexual concerns. It's a part of our lifespan, and we'll continue going through it, and it's going to evolve and change. And don't, be afraid to reach out for support and help. And it doesn't mean you're going to be in therapy for years and years. I've seen some people come in and get, one session of just getting permission or meeting with a doctor like yourself who's positive and just informing. And
yeah,
yes, you're not alone. We're all
Mm.
going through these things. So if someone's I've seen so much healing, just someone being able to say, "Oh, that's my experience too," or,
Yes.
"Oh,
Yeah.
my body looks like your body." Oh, yes, we all
Yeah.
can connect and support
Yeah.
each other. So you're
It's
not
all
alone.
not the made up social media world that, like, everyone looks, or
Sex is
it's
the most imperfect thing we do. So let it
yeah.
be weird. Let it be, let it be ebb and flow and change. It's not meant to be Hollywood's version. It's just it's our
Good.
own. We got to make it our own, and we got to take charge of our own sexuality for sure.
I love that. I love that. Well, thank you so much, Shannon. This has been great. I'm so glad I connected with you and that we have so much in common. I didn't even know. So hopefully, I'll get to see you in Long Beach in February. When are you coming to?
I'm gonna
Oh,
be there. Yes.
yeah,
Yes,
yeah.
I will
Okay.
be there.
Awesome. So I'll look forward to meeting you in real life. And then this has been a great conversation, and I hope to have another one with you. So we can delve more into some of this. But I really appreciate you being on today.
Thank you.
Thank
Appreciate
you
it.
so much. Thanks everyone for listening. I'm Dr. Smina Rahman, Gyno Girl. Remember, I'm here to educate so you can advocate for yourself. Please join us again next week. If you have a second, please subscribe to this podcast. I'd love for you to be a follower and learn as much as you can about the things that we're going to talk about with all the people on our journey. Please review us on Apple or Spotify or wherever you listen to podcasts. These reviews really help. Review us, comment, tell me what else you want to hear. To get more information, my practice website is www.cgcchicago.com. My website for Gyno Girl is www.gynogirltv.com. My Instagram is Gyno Girl, so please follow me for some good content. Additionally, I have a YouTube channel, Gyno Girl TV, where I love to talk about all these things on YouTube. And please subscribe to my newsletter, Gyno Girl News, which will be available on my website. I will see you next time.